All right, Dr. Patel, let's talk about dentures. And I have heard that there is this new thing out there. I call it a hybrid. It's dentures and implant combined, but not as many implants as like fixing all the teeth with implants, which is enormously expensive. And of course, dentures we know have a really, well, a bad reputation. It kind of like they have a diminished life. People who have dentures just don't feel all that good anymore. But there seems to be that implant-supported denture out there, which apparently does wonders. Tell me whether that's true. Tell me what are the pros and cons on it. Is it really such a phenomenal thing? Yes or no?
People that have dentures either like them or hate them. And the reason they hate them is they don't fit well. We have now implant-supported dentures where we are able to just put 2 implants, 4 implants, and now the dentures are almost fixed. If you don't mind wearing a large piece of equipment in your mouth but need extra support, implant-supported dentures are the best alternative.
What do you mean by if you don't mind
just denture?
Wearing a large piece in your mouth?
When you have an implant-supported denture, you cannot have a horseshoe-shaped denture. You cannot have a bridge-like denture where you only have the teeth sitting on your gums. You still have to have the palate in order for you to wear that denture. Okay, if you're just doing minimum implants like 2 implants. However, those 2 implants are going to hold the denture for you in a very nice position where they don't fall out, they don't move whilst you're eating. They function much, much better than just dentures without anything. So implant-supported dentures are the best thing to have if you can only afford a minimum amount of support, rather than, like you mentioned, having 6 implants and all your teeth fixed.
Okay, I got it. So there is like two. You have the denture. Normally, the denture starts getting wiggle woggly. People usually think the denture wears out when it is really their gums which are shrinking, right? You know,
the bone resorbs, yes.
The bone resorbs. But either way, you get that funny feeling, and you get food stuck underneath, and you have your palate covered with acrylium, plastic, whatever it is, metal,
right.
And thus you don't taste the food so well. So anyway, just remembering our grandparents, putting that thing in a glass makes us feeling old, and it doesn't matter whether we are now 70 or 50, whenever we need the dentures for whatever reason we do so. Usually a negligence of going to dental work in the first place that it comes to that part, but that's a different story. There we are. Now, if you only put 2 in it, you say you still need the covering the palate because
you still need.
Got it.
But you still need support from the tissue in order for the denture to be stable.
But it is drastically improved in terms of when you bite into a corner of
Drastically improved means you really have to exert force to remove it once you put it on. Beautiful. That's how drastically improved it is.
Now, at what point, let's just say you put in 3, because I can, looking at the table with, or for that much a bicycle, when we learn bicycling as kids, first we get like a couple of other wheels to it, you know what I mean? So obviously 1 or 2 more implant would stabilize the whole thing. A table with 3 legs stands a lot better than a table with 2 legs, which probably wouldn't stand at all.
The more the implant, the lesser the plastic you can have.
Beautiful.
The more
and
the
better
implants,
the fit and all that.
Exactly. Yeah. You can reduce the amount of plastic that you have to have in order to do more implants. If you do more implants, then you can definitely reduce the amount of plastic, which is the biggest advantage in covering your palate and being able to taste and feel warm and cold and all those phenomenon when you're eating.
Again, $1 million question here. I come to you, I don't have lots of money. I can do, let's just say, maybe only the denture, and then you tell me it's whatever, another $1,000 for the 2, and then I say I can do that in 3 months. Will you be able to make the denture so that I can keep upgrading? First, I do the normal denture with the intention in 4-6 months I do 2 implants. Another 4-6 months later I do another 1 or 2 implant. Can that be done?
We definitely can do that. That's exactly what we suggest to most patients at the moment when patients come in and they have very bad teeth and they're needing all those teeth taken out for some reason and we're making dentures. We will always have a discussion on implants. And we will always have a discussion on implants as to the numbers of implants, whether it be 2 minimum or 4 or 6, and the different types of dentures then that can be made. And the addition of implants later on can easily be done. All we need to do is retrogradely fit the denture to the implant by making some adjustments to the denture, which is not a big deal.
And as you increase the implants, you can decrease that metal on the palate.
Plastic.
The
Yes.
plastic on the palate. And
Yes.
the person now can taste food again.
Yes. Yes,
That would
that's exactly.
that'd be my biggest concern, not to taste the food
That's
again.
exactly it. That's exactly it. Expanding on your conversation, now there is a concept called teeth in one day. So what happens is patients come in, they have 7 or 8 bad teeth, they have all these teeth removed, 4 or 6 implants put in, and they walk out of the office with teeth in place, screwed into those implants. They never go without teeth. So your question was just whether we can do dentures and implants and what is the advantage of just having 2 implants for patients that can't afford it. On the other scale, there are patients that can afford it and they can have this other service. So there's a wide range of things you can do with dentures and implants now.
Beautiful. We're going to talk more about this one-day implants or those one-day teeth, whatever you call it,
Right.
to explain that to the patient and to explain, who would benefit from that. Would it be if there's a
Right.
tooth missing here, one here, one here, one here? How does it work? But anyway, so can a person who has an implant-supported denture with, let's just say, 2 or 3 implants, can he chew on a spare rib? Can he bite into an apple? Yes or no?
Definitely. Definitely. A very big difference between not having implants and dentures and having 2 implants and dentures. Your life will improve tremendously having just 2 implants underneath your dentures
I
as to
think we
what
should.
you can do with it.
I think somebody should tell those apparently 40-some million people who have dentures.
Yes, yes. And they don't, they don't even need, let's say that you've been wearing dentures for 20 years and your bone is completely resorbed. Now we have something called mini implants, which can be done very easily, inserted in, and the denture readjusted to fit those mini implants, and the patient walks out with almost a fixed denture.
So what you're saying here is that the saying, the myth or the concept that once the bones are too far resided, basically they're gone because bones do disappear when the root is out. It's like muscles. If you go into a cast, and for 5, 8, 9, 12 weeks, your hand will be
There's
thin
an
like
atrophy.
it's not the
Totally
body
atrophied,
knows
yeah.
the body knows when a body part isn't used and it just says, okay, not used, let's decay it.
Right.
But so the point of what you're saying is, even if that has happened today, there is a way to still put implants in it, because not too long time ago, then it's like, sorry, too late, we can't put an implant anymore, there's nothing there to screw it in. That, you say,
Yes.
that time is gone. Is that what you said?
Yes, that
Oh,
time
wow,
is gone. People can come in. We have CT scans which show us where the bone is, and we can place wherever the bone is. And now the sizes of implants have changed, where there's not only big implants, there are small implants, So and the small implants are working also just as well, which is being proved by the placement of so many out there. So it's a tremendous time that we are living in.
Right. Well, so I'm very sure that, I mentioned there's about 5 million people in denture. That's a number I heard somewhere. It might not be 100% right. But I'm sure there's a lots of those people, they had it for ages, and they may have been told back then when only the big implants were possible, or when this concept of implant denture wasn't quite possible, they simply might not aware of that they could have something so much better. And what would be better than living out your last 20 years, being able to sit at the kitchen table with other people at Thanksgiving or God only knows where, when, and be smiling and be like, basically looking good. They don't call it $1 million smile for nothing, because it changed. I mean, there's nothing which changes a person more than a smile. I mean, forget cosmetic surgery. I'm not saying that it doesn't do its job, but try to do it without a beautiful teeth. It wouldn't go anywhere, would it?
No, it wouldn't. No, it wouldn't. And dentures with implants are way better than not having any.
Right.
I have not come across any person that has had dentures and has had implants placed afterwards not tell me what a difference it has made in their lives.
And that's really what, isn't that what any person who provides any service, and doctors of course more so maybe than other ones, isn't that what life is all about, to enhance that person's lifestyle? Sometimes, like, only because of a measurement or because of whatever, it's not the actual bad looking which is bad, it's because of it the person becomes antisocial. He doesn't go out anymore, he doesn't do this anymore, he doesn't do that, and depends on his age, it will affect
It's funny,
him differently.
you will always see people come in and they'll have very big mustaches covering up their lips, and they will not smile because they're ashamed of their teeth. So yes, it makes or like we are discussing dentures, their dentures are dropping or something is happening and they're not really comfortable.
Right. Well, even if the denture would never come out, I mean, have you ever worn a shoe which is a little loose? Not enough to come off really, but it's a little loose. Immediately you start walking different. You start feeling uncomfortable. So if I sit with people and I'm not sure whether my denture will come out, of course I will do everything to prevent to go, ha ha, ooh, ah, because I'm afraid it comes out, even though it might not. It's just that feeling that it might come out alone will make the person, introverting, so to say.
Yeah,
Don't it?
there's a very, very good analogy.
Yeah.
That's a very good. You have to make adjustments, yes, when something's
Well,
not fitting well.
it's wonderful that there's something out there which, makes people biting in on apple, eating again, doing those funny things, and feeling good and looking good. Absolutely great. Dr. Patel, thank you very much. Very, very, very informative.